Let's move on to some other issues. Virtual hospitals that track a patient's blood pressure and oxygen saturation from their own home could be introduced to help with the overflow on the nation's hospitals. Sue Dunlevy, health reporter, national health reporter for News Corp. She joins me now via Skype. Great to have you on the show. I'm always looking to you, Sue, for a bit of good news and something coming on the horizon. I want to start this pretty innovative idea to basically allow people to stay at home with this disease, but also have all the security of doctors monitoring things that might change and might need them to move into hospital. Explain it for us if you can.
Well, this is great. It's sort of like some fantastic Aussie ingenuity. There was a who has been working on this idea to solve the rural health crisis, where there are some very tiny hospitals in outback Australia, and when they've got patients it's very hard to get doctors or specialists out to them. But he's fast tracking this idea now and thinks it can be used to help deal with the massive demand that our health system is going to face as a result of the coronavirus. So the idea is that instead of bringing the patients who are not so, drastically ill into the hospital system and using beds, you could keep them in their own home, but have them monitored by specialist equipment. So it would be a monitor that you would attach to the patient that would measure their blood pressure, their oxygen saturation, their pulse rate, various other vital signs. And that information would be beamed back to a large city or large regional hospital where doctors and nurses would be constantly monitoring it. And at the same time, they could connect an artificial intelligence capability to it that would enable you to, it would set off an alarm if something happened to the patient's measurements that required attention, and would notify the hospital if they perhaps needed to be rescued and taken into the hospital because they were deteriorating. The other interesting thing he's looking at using here is these mattresses that they use to measure you if you've got sleep apnea, because they can pick up and detect changes in your breathing when you've got COVID-19 that might indicate that your lung capacity was under strain and that you might need more specialist care.
Yeah, it's fascinating. It's like, I read something today about PET veterinary respirators, ventilators being deployed now, obviously, made purposely and cleaned properly for humans, but being deployed into hospitals to increase our ventilator capacity. So we're becoming quite innovative with this. I also want to touch on the reports today about a drug that will be used on the front line for nurses and doctors. I don't know exactly how it will work in a preventative sense, but it's said to be something that they will take as a prophylactic against getting coronavirus. But if it's going to work for them, why wouldn't we all be taking it?
Well, there's probably not enough supply for every Australian to take it, and so you want to protect the people who are most at risk. This is a drug that's previously been used for lupus. I don't know if there is actually any clinical trial evidence that it's going to work, but they're going to conduct a clinical trial in Australia with around 2,000 health workers and give them this medication. There might be some people out there who, for example, take antibiotics as a prophylactic, so they might get repeat infections of some kind, and so their doctor, to stop that happening, might give them a very low dose of antibiotics to stop that infection recurring. So it's the same sort of idea that you take this on the off chance that you might get infected. You'd have to take the pill every day, and it's not like a vaccine. It's not a one-off thing that will definitely prevent the disease from occurring if you get infected. And as it is just a clinical trial to see whether it might work, we don't know if it will, but it's worth a shot given that we have nothing else.
It's worth a go. Keep up the good news, Sue. And we need a little bit of hope in all of this, and I really appreciate those two details being talked through tonight. Thanks very much for your time.
Thank you.